Thank you, Paul. Good morning, everyone. I'm really pleased to be here today to give, I guess, a national perspective on where we are and what our plans are to actually deliver the transformation that we now need to happen across our health and care sector. Our vision within NHS Digital is to really help make this, the transformation of health and care a reality. What I mean by that is play our part to actually realise it, partner and collaborate and step up to help local NHS and local authorities to deliver. What's important is that the technology organisations, the national technology players, aren't seen as the IT geeks who sit in the corner. What we actually have to do is reach out and be responsive and relevant to the requirements of local health and care. And what I'll do today in my speech is talk a bit more detail about how we're hoping we can support you all in pulling together to make this a reality. Our role is the National Information and Technology Partner to the health and care system. We're responsible for data collections, for secondary uses. That's often a bit clunky. It puts a burden on the wider NHS and providers, so we're working hard to make ourselves more timely and release some of that data out to health and care providers in a more timely way. We managed to secure £4.2 billion in the spending review last year, and we've been given responsibility to deliver the portfolio of programmes that make up that money. And again, importantly, we must not be that national organisation that does this to the NHS and to local authorities, but rather lots of the money is about enabling and creating an ecosystem. And again, I'll talk a little bit more about that, as well as having infrastructure responsibilities, cybersecurity response, and other national systems. I joined NHS Digital on the 1st of June, moving over from NHS England, and my specific remit is to help NHS Digital to be fit for purpose, to deliver the benefits to patients, clinicians and social workers of technology. Just a quick reminder of the 5-year forward view, the strategy for transformation across health and care. And at the same time as that, we delivered our strategy, Personalised Health and Care 2020. Again, importantly, explaining how central technology, information and data are to the delivery of transformation. I don't believe we will make the change without the use of technology. And of course, now we have to make that a reality. Now, the way we've organised ourselves around the money is through these 10 domains. They're just our way of describing the work in a way that's meaningful to the national leaders of policy, urgent emergency care transformation, general practice, etc., and not use words that are overly technology focused and that make people think, that's their job, it's not our job. All our system leaders, all our local leaders need to understand that technology is their job, that it's an enabler, but they have to get their heads around it and get the support they need if we're going to make this a reality. So given the time I have available today, I'm not going to go through each of these domains, but rather focus in on a few of them that I think are specifically relevant to this conference. And also, I specifically need help from the TSA and from yourselves to help us make this a reality. So domain A, patient engagement, self-care and prevention. Really, this links into the theme of connected communities. Through Patient Power, we'll be looking at a single identity platform. Of course, when people are dealing either on the phone or face-to-face for their care needs, verifying identity is straightforward. But if the transactions start to be done digitally, electronically, we need to make sure that the person at the end of that digital transaction is who they purport to be. And so there's some infrastructural needs building on the GDS Verify service that we do need to get in place to help us move to those digital transactions. We're going to be improving the personalised information and guidance that we give, for example, reminding people that it's time to book or order their repeat prescription, putting tools in the hands of patients so they can book appointments and actually order the prescriptions. And importantly, set up a framework for apps and wearable devices that allows our care professionals to feel confident that they can recommend these apps because they're within like a kite marking type framework. We won't be building these devices. We need to create the ecosystem, the environment that allows the market to prevail, that allows local initiatives like Sheffield Flourish to know that they can use some of these devices, knowing that it's all safe, it's all been verified, and everybody, and also other people across health and care have been using them. We also, within this patient power, are introducing free Wi-Fi. We believe to reduce the isolation for people who are either in hospital or in care, to allow them to go on the internet and use social media. We really need to modernise and make this a reality for our patients. But increasingly, we cannot turn our back on the fact that, as Ros said about health inequalities, we have 6 million citizens who are currently not online at all, and 12 million citizens have very low literacy. So we will be moving forward with our work on widening digital participation. We did a successful programme with the Tinder Foundation over the last few years, and that will be, we have the funding to drive that forward and make sure that nobody is left behind as we move forward on this journey. I just want to build on the theme of diabetes. I am the national sponsor for one of the test beds that you may have heard about. There are 7 national test beds. The Internet of Things test bed, one of them in Bristol, is the Diabetes Digital Coach, and I'm working very closely with them to help to make this a reality. So it's west of England. AHSN are the main area that are leading on it. And Sandra here has lived with type 1 diabetes for 55 years. As has been said earlier, the technology's already transformed the way we treat diabetes, from the 1960s urine tests, the blood glucose monitors, insulin pumps, and now we have continuous glucose monitoring. What this test bed is doing is offering 5 different digital tools using Internet of Things technology to actually monitor, sort of in the wild, the uptake of how these technologies are used. And they range from helping citizens to look up advice for their health and well-being, their structured education, decision support, and optimizing physical activity, as well as insulin management. The main thing we need to drive around diabetes, which is proven and has been said already happening across parts of our health and care landscape, is to prevent people's condition deteriorating and help them to continue to live their lives the way they want to. Delay the complications. 78% of the billions that we spend annually on diabetes care derives from complications from the deterioration of the condition. And so if we can keep people healthy and well and managing the conditions themselves, these technologies can really help. So it's fantastic to see so many examples of that here at the conference. And again, nationally, we're hoping to drive some of that local innovation through, for example, the test beds. The other really relevant programme within the portfolio is integrated care and social care that really speaks to the connected care slogan within the TSA work. This is about joining health and care organisations to themselves, but also health professionals to each other. Our public already believe that information about them is shared across care settings, but we know that that is not necessarily the case. It's sometimes the case, but not enough is that a case. So again, this work is central to the delivery of the new care models. It's about enabling everyone who's involved in care to receive or send appropriate information at the right time, and the users themselves having access to their information, adding preferences, adding care plans, adding their own experiences and their own personal data. The way we're going to do this is really through the sharing of structured data. Open APIs and NHS number, I know it's a technical term, but if we can be buying software and building software that has open standards as standard, then we can make sure that clinicians don't have to be logging in and logging out of 3 or 4 or 5 systems to get the information they need, but the information is embedded as standard. We are relying on the market response to this, and we're starting with the GP Connect initiative, and rolling out summary care record, giving API access to that, plus a record locator service. But again, it's not about what the centre does. It's about how we have localities joining up with the centre and making sure that really usable and useful standalone systems locally can connect nationally so that that information flows around the system as the patient moves, as their care moves around different parts of a health and care system. We'll also be providing more support to social care, mental health and community services to help them integrate, because it's felt a little acute-centric in the past around our investment in technology. So an example of that is around child protection, information sharing, where we're offering training and working with the software suppliers to help people on the front line to make this a reality. It wouldn't be right and proper for me to not mention paper-free at the point of care. The vast majority of the money that we've secured will be going to the front line to help providers, not just acute mental health community providers, to get off paper, to actually finish the job that general practice finished many years ago, where we have 100% digitisation in primary care. And I'm really pleased to hear that the TSA is going to be helping create a digital leaders network. We don't have enough capability across our boards, across CCIOs and CIOs, and also to deliver the transformation. So a digitally literate workforce is central to our plans, again, to make this a reality. So in closing, there is a lot to do. We need local input, we need industry, we need partnership and collaboration, so that we work with NHS and local authorities and we do not do this to them. I want to see local knowledge, local expertise reflected in national solutions, and I want our national skills and expertise to be actively helping on the front line to make this change journey happen, so that overall the solutions that we develop are useful, usable, and ultimately used by our patients and clinicians and social workers. Thank you very much.